Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Common conditions that can affect the uterus. Several health conditions can affect the uterus or womb. Some are serious, while others need minimal treatment. Many involve similar symptoms such as pelvic pain or irregular bleeding. It's important to see a healthcare provider so you can get the right diagnosis and treatment. /r/n/r/n This article explores some of the most common uterine health conditions. It also takes a look at how they are diagnosed and treated. /r/n/r/n The uterus is a pear-shaped structure in the pelvis. It sits behind the bladder and in front of the rectum. The uterus grows during pregnancy. Afterward, it shrinks back almost to its original size within weeks. /r/n/r/n On each side of the uterus are the fallopian tubes and ovaries. The uterus, vagina, ovaries, and fallopian tubes make up the female reproductive system. Because these organs are so close to each other, pain in the pelvis could be related to the uterus or something else entirely. /r/n/r/n Some of these health conditions begin in the uterus. Others are caused by factors outside the uterus, such as hormones. /r/n/r/n Dysmenorrhea is menstrual pain. It can occur before and or during your period. Period pain is not necessarily a sign of a medical condition on its own. It often improves with pain medication or hormone therapy. /r/n/r/n Heavy menstrual bleeding, previously called menorrhagia, is excessive menstrual bleeding and can also refer to bleeding that lasts too long. It can occur without any known cause, or it can be a symptom of /r/n/r/n Heavy bleeding can cause iron deficiency anemia, a low red blood cell count. If your red blood cell count is low, you may need treatment to control the bleeding as well as the anemia. /r/n/r/n Pain and heavy bleeding may be related to a uterine problem. Pain on its own isn't always a sign of a disorder. Heavy bleeding may be from hormone changes, growths, medications, or even cancer. /r/n/r/n Uterine prolapse means the muscles and ligaments that hold the uterus in place have weakened. The uterus drops. Many people have mild to moderate uterine prolapse when they get older. /r/n/r/n The most common symptoms are /r/n/r/n Sometimes the uterus has an atypical shape. This can make it harder to get pregnant and can raise the risk of miscarriage. Your healthcare provider may spot the condition on an ultrasound. It is most often diagnosed by an MRI or a hysterosalpingogram. /r/n/r/n These differences can include /r/n/r/n Some conditions change the shape or orientation of the uterus itself. If your uterus sits too low in your abdomen, tilts back, or has an unusual shape, it can cause pain, urinary leaks, or pregnancy problems. For some people, these differences don't cause any symptoms at all. /r/n/r/n Sometimes, bacteria or microbes enter the cervix and spread upward. The infection can affect one or more of the pelvic organs, including the uterus, cervix, and fallopian tubes. This is called pelvic inflammatory disease, PID. /r/n/r/n Symptoms can include /r/n/r/n Uterine polyps are common. These small, soft growths in the uterus may cause heavy menstrual bleeding, spotting between periods, and bleeding after sex. /r/n/r/n Fibroids air growths in the walls or lining of the uterus. Sometimes, they attach to the outside of the uterus by a stalk. They can be as small as a seed or larger than an orange. /r/n/r/n Symptoms include /r/n/r/n Although fibroids are sometimes called tumors, they are not cancer. They do not invade tissue or travel to other parts of the body the way cancer does. /r/n/r/n Endometrial hyperplasia occurs when too many cells grow in the lining of the uterus. The uterus becomes very thick as a result. The condition can cause abnormal bleeding. /r/n/r/n It is not cancer, but in some cases, it can lead to cancer of the uterus. Symptoms include /r/n/r/n with endometriosis, the same kind of tissue that lines your uterus grows in other parts of the body. Most of the time, it grows in the abdomen or ovaries. This can cause scar tissue to build up around the affected organs. People who have endometriosis often have endometrial hyperplasia, but not always. /r/n/r/n Symptoms include /r/n/r/n The cause of endometriosis is unclear, but there are various theories. /r/n/r/n Sometimes, scars form after uterine surgery, radiation, or injury. These scars are also called adhesions or Asherman's syndrome. It may lead to not having periods or light bleeding during your periods. Severe cases can cause pain or infections. /r/n/r/n Uterine cancer causes abnormal vaginal bleeding. The most common type is endometrial cancer. It requires aggressive treatment if it has spread beyond the uterus. /r/n/r/n Abnormal cells can sometimes grow in or on the uterus. Polyps, fibroids, scar tissue, cancer, microbes, and extrauterine tissue can cause bleeding, pain, and other symptoms. /r/n/r/n If your healthcare provider can't identify the cause of your pain, you may be diagnosed with chronic pelvic pain. This can be caused by pelvic floor dysfunction, which is also seen in conjunction with uterine problems. You may need treatment when your pain becomes worse. You may also be more sensitive to other painful conditions, such as gastrointestinal or bladder infection. /r/n/r/n Symptoms of disease of the uterus include /r/n/r/n In each phase of your menstrual cycle, the uterus changes. Symptoms may get better or worse throughout the month. /r/n/r/n Your medical history and symptoms can help your healthcare provider decide which tests you need. Some of the most common tests are /r/n/r/n If you're having pain, bleeding, urinary leaks, or pregnancy problems, a pelvic exam and pap test may be enough to pinpoint the problem. If not, you may need urine, blood, imaging scans, or scope tests to confirm a diagnosis. /r/n/r/n The right treatment depends on what's causing your symptoms. Some of the most common treatments include /r/n/r/n In some cases, treatments are combined. That's especially true in severe cases or those where a single treatment didn't work well. /r/n/r/n The uterus can be affected by many different conditions, some of which have similar symptoms. The conditions may be caused by the way the uterus is formed, by infection, by hormonal changes, or by scars and growths. /r/n/r/n Most of the time, symptoms include pain, unusual bleeding, and urinary leaks. Physical exams, lab tests, and imaging scans can shed light on the problem. Medication, hormones, embolization, and surgery are all options for treating different conditions. You and your healthcare provider can work together to create a treatment plan. /r/n/r/n You should seek immediate medical help for anything that could lead to sudden blood loss. That includes ectopic pregnancies, PID with abscesses or fluid-filled pockets, fibroid complications, and uterine bleeding. /r/n/r/n Several uterine conditions can cause pain during sex. These conditions include fibroids, endometriosis, pelvic inflammatory disease, and ectopic pregnancy. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.